Hi, my name is Gabrielle Entile with Drug Topics, and today I'm talking to Dr. Robert Brunault, who is a clinical pharmacy specialist of hematology and oncology at Rhode Island Hospital and Lifespan Cancer Institute. Dr. Brunault, thank you so much for joining us today.
Yeah, no problem. Thanks for having me.
What do you think are the biggest concerns right now regarding health system pharmacists and COVID-19?
So I would say probably the biggest concern for everyone within the healthcare system is kind of just the, you know, lack of or difficulty acquiring personal protective equipment. So I think especially in these times, it's really highlighted, you know, we need to be prepared as hospitals and as a country and health systems as a whole, just ensuring that all of our hospitals and healthcare systems can get the necessary personal protective equipment. So I think that's probably a concern that's at the forefront of most people's mind. But again, I think our a lot of hospitals, our hospital and a lot of hospitals that I've heard about are taking the necessary precautions and really trying to promote, you know, social distancing, the telemedicine, and things like that.
Great. And then given that there were already shortages of some injectables, what problems are you foreseeing moving into this pandemic in terms of drug production?
Fortunately, our hospital hasn't had too much difficulty with procurement, but I've definitely heard of shortages regarding like IV opioids. There's certain drugs that have been thought to help with some of the symptoms associated with more severe cases of the virus that have been going on shortage as well. I think right now it's such a moving target as to which treatments are providing the most benefit. And I think that that's good in a way because everyone's trying something a little bit different. And maybe that'll be a better way of finding something that can be beneficial in the treatment.
And then kind of creating a little bit of a broader scope from an oncological perspective, why is it imperative to put social distancing into practice?
Yeah, so I think this is such an important thing, especially for cancer centers and hospitals that deal with an oncology or hematology patient population. Because, you know, a lot of these patients have to come into the cancer center to get treatment. We have to have healthcare providers here. And by practicing those social distancing techniques, it really prevents one person from giving the virus to either a healthcare worker or a patient, and then really having that run rampant through an area that potentially has a number of immunosuppressed patients who have a decreased ability to fight off the infection. And I think it's important to note that there's not an unlimited supply of healthcare workers as well. So, you know, if the general public takes the necessary precautions as well, it really helps make sure that there will always be healthy workers here to provide the best possible care for the patients.
And then in your opinion, has the national and also the societal responses been enough to protect at-risk people, such as people with cancer, from the pandemic? And how do you see the next few weeks unfolding in regard to coronavirus?
Yeah, so I think a lot of good steps have occurred, especially with closing non-essential businesses, although difficult decisions, closing non-essential businesses, promoting stay-at-home orders. And I think that's all been helpful. I think, again, kind of to go back to the personal protective equipment, I think promoting you know, manufacturing and ensuring that healthcare workers have access to that equipment is really key, especially for the weeks to come. From some projections I've seen, it seems like, you know, the worst is still yet to come. So I think it's difficult to 100% be prepared for these situations. And we're constantly refining our approach to patients coming in, anticipated surges. We actually just had a phone call this afternoon kind of discussing, you know, what we anticipate, how we're going to approach it when that surge happens. So I think as a society and as a country, we're taking steps in the right direction, and we're continuing to refine them. So hopefully that will be enough in the coming weeks to help keep everyone safe.
So, I saw something with the FDA where they have allowed access to chloroquine and hydroxychloroquine in treating hospitalized patients. How do you feel about the FDA authorizing these drugs without finishing the clinical trials and going through the entire process?
Yeah, that's a really good question. I've kind of been following some of the FDA alerts as well, consulting with our infectious disease pharmacists as well, just to make sure that we all have a good grasp on this. And I think right now, a lot of the drugs being used are still in the experimental stages. I had mentioned there's other drugs that are going on shortage because they're believed to help with some of the more severe cases. There's also some antivirals that are being studied as well. So I think endorsement of some of these drugs is good to help promote, you know, if something has a little benefit, it's good to try that for patients. I think, again, as time continues and we learn more about the virus, we'll have kind of a more streamlined approach to treatment, and we'll be able to rule in and out which treatments are most effective. But in the short term, it's nice to know that we may have some drugs that are beneficial in helping the patients who are suffering most from the severe complications of the virus.
Awesome. Dr. Brunault, thank you so much for joining us today. And to our audience, we hope you found this informative, and please stay tuned for another timely interview from one of our sister MJH Life Sciences websites.